Global Summit on Circulatory Health is a unique event. It brings together, under the auspices of the World Heart Federation, all of the major international organizations: stroke, hypertension, nephrology, primary care, public health, and many more, with an interest in circulatory health. And the purpose of bringing all of these organizations together is to advocate for improved prevention and control.
We're delighted to be at the summit because it highlights a critical issue of access to essential medicines and products. And PATH is Secretariat for the Coalition for Access to NCD Medicines and Products. And we believe it's going to take a multi-sectoral approach to address this critical need.
I consider the summit very interesting because it gathers different healthcare professionals, different perspectives, so you learn from one another and enrich the expertise of one another. And I really find interesting that approach around access to medicines from outside the traditional arena where it's there, because that's where you are able to get new ideas and enthusiasm and expertise from interesting experts.
It's really quite amazing that at this stage in the 21st century, so many people in so many countries lack access to essential medicines and technology. It's been a really good opportunity to bring people together from a wide range of backgrounds, from clinical medicine, from cardiology, from health policy, from epidemiology, health systems research, to try to find some solutions to this challenge. But there's much that we can build on. We have universal health coverage in the Sustainable Development Goals. Our governments have committed to making this a reality, and now it's up to us to hold them to account.
I think the summit is an incredible opportunity for leaders from across the world, researchers, and those in advocacy to interact with government organizations, to learn from each other, to share some of their best practices and enthusiasm.
On the global health agenda, there are different platforms that can be used to really advocate, and I think access to medicine is a major topic on the Sustainable Development Goals. And as Salim Yusuf mentioned, the World Heart Federation is a small but very active organization in terms of outreach, and I think this is important for us to be able to reach out to those stakeholders and to the frontliners everywhere, and those advocating for circulatory health in particular.
The summit on access to essential medicines is very unusual. We have many treatments that work, they're inexpensive, yet the majority of people in the world do not get these treatments, and these are factors that are being discussed at this summit. If we can improve these treatments, we're going to make a big difference to people's health.
There are so few conferences where you can address the world's leading killer in cardiovascular disease and circulatory health. Here we're focusing on access to essential medicines, which is the second, or in some cases even the first, cost center for Ministry of Health budgets. Certain countries, there's 2 to even 3% of GDP devoted to essential medicines. 40 to 50% of budgets are focused on these treatments alone. Problem is, despite all that fanfare, we've made very little progress on getting these essential treatments to people around the world. This summit provides a rare opportunity to enable access to all.
The Global Summit gives us the opportunity to have roundtable discussions, facilitate that policymakers, public health workers, cardiologists, cardiothoracic surgeons can speak about opportunities how to tackle a disease from prevention to managing the condition itself.
The summit is so important for me to attend because I've come to meet all the leaders around the world. These are people with whom I've collaborated and people with whom I really want to be collaborating with. You've got to come.